फ्रेंड्स, गुड इवनिंग। आई एम डॉक्टर आशुतोष और आज हम बात करने वाले यूट्रोप्लेसेंटल इंसफिशिएंसी के बारे में। ओके, सो व्हाट आई हैव डन इज दिस कि दैट वी हैव कलेक्टेड द यूट्राइन आर्टरी डॉपलर्स एंड हाउ डज इट behaves during those trimesters, right? Okay, कि first trimester, second trimester, third trimester, with the increasing gestational age, how does this uterine arteries which is high in first trimester, how do they behave first? What is the effect onto the umbilical artery ultimately, because umbilical artery is the artery that supplies the blood to the fetus, right? And then it lends up and then it culminates into sort of an absent and diastolic flow. And how does it behave and when does it end up with an absent and diastolic flow? And then probably that gives us a signal so as to take the baby out from the uterus, right? Okay, वो मैं आज आपको बता देता हूँ। 13 weeks and then the uterine arteries flow. ठीक है, तो right uterine artery है and then the left uterine artery. So both the uterine arteries are showing that there is high resistance. Then we are following it 16 weeks. So even though they have remodeled, but in fact we are identifying the post-diastolic notch in both right and the left uterine arteries. Right, then we have gone to, this is at 20 weeks, 21 weeks and so the right uterine arteries is showing when high resistance is being shown in the umbilical artery vis-a-vis, okay, so which lands up with a very high umbilical at 32 and then lands up with an absent and diastolic flow. And then we are putting all those things onto a graph. So ये RI and then the PI है which is showing of the umbilical artery showing that it is greater than 95th centile. And how do we look around for? तो मैंने ऐसे बताया है कि हम ये preload index IVC को दिखा रहे हैं which is 50%. Uterus is being supplied by the uterine arteries both on the right and the left hand side. पहला, दूसरा, there is a continuous remodeling happening in the uterine arteries that starts at 12 weeks, 12 to 13 weeks. So first wave of remodeling happens at something around 16, 18, and then the second wave happens at something around 26, 28 weeks. And the third is this कि मैंने पहले भी बताया हुआ है कि it works on a Poiseuille's phenomenon. For Poiseuille was a renowned physicist and therefore he has told that if you increase the diameter of the uterine arteries by half, the resistance of the blood flow is going to fall by 4 folds. दोबारा बता देता हूँ कि अगर उस धमनी जो आर्टरी है उसके डायमीटर को आप आधे से बढ़ा देते हैं तो जो रेजिस्टेंस है वो 4 गुना घट जाता है, राइट? सो many times we identify that this remodeling doesn't happen the way it should happen, right? And that leads into a high umbilical artery resistance. And at 16 weeks it is the earliest that probably we can identify that the establishment of the post-diastolic flow in the umbilical artery is being established, which is a very good sign. And then we follow it out across and then we see at 24, 26, 28 weeks so as to identify the umbilical artery flows. So this uterine arteries, they fail to remodel vis-a-vis with the increasing demand of the baby from the mother, and therefore by 26, 28 weeks we identify that the umbilical artery becomes very less. And therefore what we can do is this, that there are some things available for us that probably we see them at 12 weeks, and then we follow at 16 weeks. 95% of the cases is usually falls into a normal criteria, the uterine artery flows. If they don't, then we start with the low molecular weight heparin. We have our own doses and titration schedule so that we continue the pregnancy. So salvageable baby, meaning thereby take home baby, meaning thereby that at 28 weeks if we'll end up with an absent and diastolic flow at 1200 grams, the baby would definitely get into a NICU and a lot of troubles and all the stuff, right? Okay, if somehow we are able to continue the pregnancy up to 32 weeks and something around 1900 grams or 2 kgs is the baby, so it is a take home baby, right? And in the last, with an absent and diastolic flow, how do you look around for? Because ductus venosus hypoxia में dilate हो जाती है और उसका blood flow बढ़ जाता है. So meaning thereby that with reversal in umbilical artery also there could be continuous forward flow in ductus venosus. So meaning thereby how do you look around, what is the culmination and end point? So that is a preload index. So we can see the left hepatic vein or we can see the IVC with the percentage reversal of the A wave in the left hepatic vein or the IVC is greater than 30%, so meaning thereby that this is going downhill, right, which is called as the preload index. So the preload index IVC, ideally normally it is less than 30%. If it is greater than 50%, then we identify that it is not a good sign, and it is a sinister sign, right? So this is how we follow it out across by looking around for the uterine arteries, both in the first trimester, second trimester, third trimester, and then we look around for the umbilical artery flows. We follow the umbilical artery flows, look around for the absent and diastolic, and then we look from the PLI IVC. So that is how we follow it out across, and we hope that probably we are able to take the baby up to 32 weeks and 6 days, like in this case, and it was 1900 grams, and take home baby, right? Thank you very much for your patient listening.